Welcome back, everyone, and thank you so much for coming back for this afternoon. I feel already we've had just a great day, and I know that I've learned a great deal. Like everyone in the room, I've been involved in public-private partnerships for a long time, but it's just always interesting to hear other people's views and slants and opinions on things, and I think it was nice to be reminded today, right at the beginning, of the importance of community engagement and getting that buy-in and how important that is. We went through some wonderful examples of public-private partnerships, some really good reminders of key elements to success. And in fact, David Oates' slide 9 from Save the Children looked to me like some of the best marriage guidance I had ever seen. If you look at the slide, it will give you some of the ideas of how to maintain partnerships. It doesn't necessarily need to be public-private. It looked as if it had respect for each other was one of the things that I came away from. I also noticed his concept of jettisoning humility, which reminded me of the obituary in the London Times for David Ogilvy, the great public relations guru who set up the film Ogilvy. It said that David was unencumbered by self-doubt. And I just think that is, I think what our David here was telling us, that his supervisors were suggesting that he jettisoned humility. I work in a highly regulated environment in the pharmaceutical industry, and regulations are obviously something that we follow and embrace, and it's really, really important that we address the regulations of the sort of public-private partnership that we're talking about, and we will be hearing from James Fitzgerald from PAHO on that. Product safety is also something that my company and my industry lives and breathes, and we will be hearing from Kate Bond from the FDA, and I'm really happy to say that the FDA is our most recent member to join our forum. So I'm just absolutely thrilled about that, and welcome. We'll also be hearing from the NGO and civil society engagement perspective from Susan Ray Ross. We heard Susan's name mentioned this morning, but oh, and I'm not going to talk about that because Susan Ray Ross is going to be telling us about it. So that was quite a step up. And Carolyn Baer from CARE is also going to be talking about responding with urgency. Urgency is such an interesting currency for this sort of work. There's the urgency of Ebola, which we will be talking about tomorrow. But I do remember, 15 or 20 years ago being asked by a journalist when I was helping to set up one of our drug donation programs in HIV and AIDS, and I said, well, we're planning this. Well, isn't the time for planning over, doctor? Don't you think you should be doing something urgently? And of course, that journalist was quite right. We do need to respond urgently to everything that we take on, but we need to do it properly as well. And I think it is finding that balance. And I think within that balance lies preparedness. And I think we will also be talking about that. So we've got 4 outstanding speakers: Catherine Bond from the FDA, James Fitzgerald from PAHO, Susan Ray Ross from SR International, and Carolyn Baer from CARE. And each is going to present, and then we'll have a chance to quiz them. And after that session, we're going to have the opportunity for a more open discussion about what we've learned today, which Joe and I will co-chair. So with that,